The coronavirus, which causes COVID-19, originated in the city of Wuhan, China. COVID-19 is believed to be transmitted primarily through inhalation. Once infected, most people experience mild symptoms, including sore throat, headache, fever, a dry cough, shortness of breath, and fatigue. However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to your blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs. As the lungs fill with fluid, the body's available oxygen decreases, which can lead to organ injury and death. The risk of serious complications increases if a person is elderly or has associated medical conditions. Once infected, a person may show no symptoms but can still infect others. What began in Wuhan has now spread across the globe.
A lot is still to be learnt about coronavirus and COVID-19, but the basic symptoms are known. The World Health Organization currently state that the incubation period is up to 14 days, but sometimes it could be longer, even up to 24 days, but typically symptoms show in about 5 days. The current World Health Organization figures said that based on 44,000 patients with the virus, 81% developed mild symptoms, 14% developed severe symptoms, and 5% became critically ill. The death rate stated by the World Health Organization appears to be between 1 and 2%, but the current initial figures are obviously unreliable, given this is currently changing situation. That said, the WHO say that about 80% of people recover without medical treatment, and some people become infected, but they don't develop any symptoms or feel unwell. It starts with a fever followed by a dry cough. It can then lead to a shortness of breath, and some patients require hospital treatment. Other symptoms are headaches, tiredness, nasal congestion, sore throats, diarrhea, and muscle aches. Symptoms often show as mild and begin gradually. If you're in a high-risk group with existing medical conditions or the elderly, or if the person develops a fever, cough, and breathing difficulties, you should seek medical attention by phoning the medical services rather than going to hospitals or medical centres, where there is a risk that you will spread the virus to others.
Vaccines and the immune response. How vaccines work. Influenza vaccines are able to trigger an immune response by mimicking viral infection. They are usually manufactured using inactivated or killed virus particles taken from various circulating influenza strains. Inactive fractioned viral components contain the subvirion particles hemagglutinin, HA, and neuraminidase, NA. In Canada, influenza vaccines are administered via intramuscular injection. These fractioned particles containing the foreign antigens hemagglutinin and neuraminidase are released from the vaccine into the bloodstream. There, they are met with an immune response mediated by various immune cells, including macrophages, T lymphocytes or T cells, and B lymphocytes or B cells. A major mechanism of action involves macrophage phagocytosis of hemagglutinin, breaking it into smaller components. After ingestion, macrophages display the hemagglutinin antigen on their surface in combination with a specific receptor known as the major histocompatibility complex, or MHC. T cells are now able to recognize and bind foreign antigens that are associated with the MHC. Upon binding to the MHC receptor, T cells become activated and proliferate into either cytotoxic T cells, regulatory suppressor T cells, or helper T cells. Activated helper T cells express hemagglutinin receptors specific to the vaccine strand on their surface and play a major role in antibody generation and memory B cell activation. Unlike T cells, B cells are able to ingest hemagglutinin independent of the MHC. Once internalized, B cells process the hemagglutinin antigen and present it on their surface in combination with an MHC. When activated helper T cells interact with activated B cells expressing antigen MHC receptors, they begin secreting lymphokines, which have several effects. Lymphokines trigger activated B cell proliferation, which leads to either their differentiation into memory B cells or into plasma cells. Plasma cells produce hemagglutinin antibodies specific to the strain of influenza contained in the vaccine. Memory B cells aid in future immune response when exposed to an active influenza virus. When an infected host sneezes towards an uninfected person, the nasopharynx is exposed to aerosol droplets containing whole, live influenza virus. Once inhaled, the influenza virus attempts viral colonization of nasopharyngeal epithelial cells. Assuming that the vaccine strain matches that of the live virus, hemagglutinin antibodies block viral attachment of live influenza virus to host epithelial cells, and overall disease is either avoided or diminished in severity.
Now, has Russia become the first country to develop a COVID-19 vaccine? Moscow says it has successfully completed trials on humans, yet no further details on when the vaccine will be released. Our Kim Hyo-sun with more.
As countries around the world pour all their efforts into winning the race to develop a COVID-19 vaccine, Russia has reportedly completed clinical trials proving the effectiveness of the vaccine. Quoting the head of the Center for Clinical Research on Medications at Sechenov University, Russia's news agency TASS reported Sunday that the research is done and they've proven the vaccine is safe. The volunteers who participated in the trials will be discharged on July 15th and 20th and will remain under medical supervision after being sent home. There was, however, no further information on when this vaccine, developed by the country's Gamaleya National Research Center for Epidemiology and Microbiology, would enter commercial production. Meanwhile, German scientists have found that COVID-19 antibodies may not last longer than a few months, dampening hopes for long-term immunity. An antibody study carried out by a medical clinic in Munich showed that in 4 of the 9 patients, there has been a significant drop in the amount of neutralizing antibodies. This suggests that recovered patients can contract the virus again. Against this backdrop, experts in the US say an antibody-rich blood plasma injection could be the next best thing to an effective COVID-19 vaccine. According to the LA Times, American scientists think this could be the most plausible treatment as of now, as the method has proven successful in preventing other infectious diseases such as hepatitis A. The paper, however, explained that there is a lack of support at the federal government level, as many think plasma-based therapies should focus on treating patients who are already sick rather than preventing infections among healthy people. Kim Hyo-sun, Arirang News.